Hello everybody, and welcome to the Tuesday edition of Video Clips, and I'll start with a couple of announcements. The first one is our IBS boot camp is this weekend, Friday night and Saturday afternoon, Eastern Time. And if you'd like to join us, pampopper@msn.com, we can get you ready to do that. Remember, if you live in a time zone that makes it difficult for you to participate live, we do record these sessions, and then I will commit this whole course to videotape within a very short period of time. I'm doing that with the microbiome workshop in case you missed that right now. Also coming up in October is the cannabis workshop, 4-part workshop on health benefits and detrimental effects of cannabis, another hot topic that a lot of people want to know about. So if you'd like to sign up for one or both of those or any of the other online courses we offer, educational programs, we have a boatload of them. So send me an email at pampopper@msn.com. Remember, it will not be long before it's October, and we will officially kick off our participation in a constructive way in Breast Cancer Awareness Month, which I have always complained during the entire month because so much of the activity is counterproductive. Pink M&Ms, pink buckets of fried chicken, and reminders to get your mammogram are not strategies that reduce your risk of dying of breast cancer. We're asking women to make a pledge to do 4 things, which are to eat a plant-based diet, more plants actually, move more, work at achieving an optimal weight, and limiting alcohol. And those are 4 strategies that actually do reduce your risk of breast cancer. Now, we're looking for 2 types of people here. One is women to sign the pledge. Every woman who signs this pledge will get a $100 gift certificate toward our educational programs and also a free lecture online on the strategies that you can use to actually reduce your risk of breast cancer. So a free lecture, a $100 gift certificate, all you have to do is sign the pledge. We are also looking for people, men and women both, who would like to go out and get women to sign the pledge. I mean, this is a constructive thing. It really brings awareness to women of constructive things they can do to reduce their risk of breast cancer. And I think this is a very, very important thing. This is a joint project with us as one of the sponsors and the Physicians Committee for Responsible Medicine. I think it is a marvelous step forward in really doing something constructive about health. So send me an email at pampopper@msn.com if you would like to be involved with this and if you would like to help us by promoting this to other women who you know. We only have 31 days in the month of October. We start October 1st. We end October 31st. That's when all the special offers expire, et cetera, et cetera. So let's really do a 31-day push to make something wonderful happen, which is hundreds of thousands, if not millions of women signing on to this very important commitment. Okay? Couple of questions from viewers that I thought I would answer. Sometimes you ask me things that I just can't type enough about in the comments section, right? So the first one is, one of you asked, you spent a lot of time on what you put in your body, but what about what you put on your body? Like, how important is it to pay attention to the ingredients that are in skincare products and in shampoos and conditioners and that sort of thing? And then there's a special category that I want to talk about, which is antiperspirants and deodorants. So the first thing is, let's look at lotions and shampoos and skincare products in general, all right? Things that you put on your skin. The biggest reason, in my opinion, that you want to pay attention to using good products is that the products that you buy commercially, the inexpensive, cheap stuff full of chemicals, I don't really think you're going to get cancer from your shampoo or your moisturizing lotion. I do think that some of that stuff doesn't work very well. And one of the things that I can share with you is in our hot yoga studio, we can always tell the people that are using cheap products when they first start coming here, because it just, when they start to sweat, and we touch those sweaty bodies, helping them learn how to do the yoga right, but when people start to sweat, what happens is that the surface is just so greasy of their skin because this stuff is never soaked in. So I think that products that are made with pure essential oils make your hair and your skin look much better. And so that would be a good reason for using those products. Unfortunately, they're not as expensive as they used to be. We carry a great line of them here if you have some interest in looking at ours. When it comes to, everybody's concerned about deodorants and antiperspirants. Unfortunately, there are some natural deodorants on the market. We don't make those here. We do make lotions and shampoos and French clay masks and things like that for skincare. But we don't make deodorants, but they're easily available in health food stores and online that don't contain aluminum and chemicals. The problem is antiperspirants, which do contain aluminum, and there aren't any natural ones that work that I'm aware of that don't. I've tried some, they don't work. So I'll tell you what I do. I don't like to wear antiperspirants or to use them because of the aluminum content. There are some good reasons to avoid that. But having said that, I also can't afford to ruin my clothes because I spend a lot of time in front of a camera, speaking, etc. So I only use antiperspirants when I'm going to be in a warm environment in front of a camera or on the stage or something of that nature, where it's just not an option for me to sweat and have, huge stains of water under my arms and all that sort of thing. So I'm just being very honest with you here. So some of you who don't have that type of activity could probably avoid antiperspirants even more than I do, but I only wear them occasionally, use them occasionally. So I hope that helps. So again, the bigger issue is the stuff that we're using every day, soaps and bath gels and shampoos and conditioners and clay masks and special products to make your skin look better and all that kind of thing. I'm pretty picky about the stuff I use. That's one of the reasons why we make it here. We make products here that I like. That's why we have the smoothies. That's why we own a green tea farm. That's why we do all the things that we do here. It's stuff I want, and then if anybody else wants it, that's great too. But it makes me happy. All right, and it keeps me healthy. That's what counts. I want you to be healthy too, but that's how we develop things here. It's stuff I want to use, and then we make it available to you. Another question that you asked is, what is the volume of food that you should eat? And if you're doing this right, you don't really have to worry about that. In other words, we are so taught by the diet industry and the health industry to watch our portions and to portion control and calorie counting and am I getting enough nutrients and all that sort of thing. If you just structure your diet the right way, you'll get enough of everything you need, and you don't have to watch how much you're eating. So my point is that if you have 2 potatoes and you want a third one, have a third one. And if you had a plate of salad and you want a second one, have a second one. If you're, again, doing this right, you're not going to have a problem. Just by way of example, people look at salad dressings. I use a fat-free salad dressing that I buy. It's available in all the stores. Maple Grove is the brand name. It has 7.5 calories per tablespoon. If I drank the whole bottle, I can't hurt myself, right? So put yourself in a situation where you're eating a diet where you don't have to be so conscious about how much and all that kind of stuff, all right? So just structure the diet right. If you're not a member and you haven't taken our courses yet, join. Let us show you how. And if you're a member, go to our website, go to the members website, and there's a video called A Tour of Pam's Kitchen, where I ask somebody to just come in, it's very informal, and film my pantry, what my refrigerator looks like. And I think, if I remember, it's been a while since we made that video, but I think the day that the person filmed me, I had just done some batch cooking, so you can see all the potatoes are done, and soup is made, and everything's ready for the week, because I don't do much cooking during the week, and that's why I can eat optimally without investing a lot of time. All right, so a couple of serious questions were asked after I did the video a week or 2 ago about cancer treatments, and I mentioned Dr. Seyfried, who's speaking here at our November conference, November 6th through 8th, and talked about some of the strategies that he's using, including a ketogenic diet. And some of you asked, I think, what was a good question? How can you endorse that if that's what you were doing when for years and years you've been talking to everybody about low-fat, plant-based eating? What's up with that? How do you reconcile that? And I have written some articles about this in the past, and they're in the Health Briefs Library, about the ketogenic diet, about Dr. Seyfried and the work that he does and all this sort of thing. But I thought it was a thoughtful question that should be answered here, and so that's what I'm going to do. So I'll just start by telling you a considerable body of evidence, some of which dates back several decades, shows that adopting a plant-based diet can stop and even in some cases reverse cancer and other diseases. So many people suffer from chronic conditions, and I think that the fact that this is gaining some traction and not such a crazy idea anymore. I mean, you can just go to any restaurant, and almost all of them that want to stay in business are serving meals for people who eat plant-based diets. I think this is a really good thing. So I'm happy to see a growing interest in this kind of thing, and that's all good. Dr. Seyfried's background is a little bit different because his research has focused on the use of metabolic therapies to manage chronic and difficult to treat conditions like epilepsy and also cancer, brain cancer specifically. In his book, he provides extensive documentation showing that cancer is not a genetic disease, but rather a mitochondrial metabolic disease. This isn't a new idea, but one that has been largely forgotten because of profitable cancer treatments such as surgery, chemotherapy, and radiation becoming significant and important, and also because the originator, if you will, of the theory, Otto Warburg, was a Jewish scientist in Hitler's Germany, and that's not a recipe for traction for a new idea. So anyway, a long story how the Warburg theory became picked up or got picked up after years of being dormant here in the United States. But Dr. Seyfried proposes several therapies, which include calorie restriction, fasting, and a ketogenic diet. In other words, it's not just all about a ketogenic diet. That's just one of the things. But he is particularly talking about hard-to-treat cancers like glioblastoma, which are almost always fatal. It is the proposal of the ketogenic diet for the treatment of cancer that I think has caused a lot of people to be very concerned. How can we endorse such an idea after promoting plant-based eating for such a long time? Well, the reason is that our decisions are evidence-based, and when the evidence is properly applied, both plant-based eating and Dr. Seyfried's ideas are very compatible. Now, we all agree, first of all, that the best option is the prevention of cancer. It's much easier to prevent than it is to treat it, and not everybody with cancer survives. So for those who don't currently have cancer, I highly advise you to adopt a whole foods plant-based diet, high in fiber, low in fat, along with other healthy lifestyle habits, and you will reduce your risk significantly. And that's the best case scenario. Put yourself in a situation not to get cancer. Some cancers, if you do develop one, do not progress quickly. For example, prostate cancer and some blood cancers like chronic lymphocytic leukemia don't progress really quickly. So people who have these types of cancers can often take time to adopt an optimal diet, lose weight, and then use conventional treatment if that doesn't work, or as an adjuvant to a healthy diet, weight loss, exercise, and that sort of thing. Not everybody agrees that diet is a good idea as a first approach, particularly oncologists who offer traditional treatments, but advice to try an optimal plant-based diet, even for primary treatment in some cases, is not irresponsible. And this has to be done on a case-by-case basis. Now, some cancers, as I mentioned before, are aggressive, glioblastoma being one of them. It's a form of brain cancer, and over half of the patients die within a year. Most of the others only live for a maximum of 2 years or so. Treatments, which include surgery, chemotherapy, and radiation, do not extend life, but are commonly recommended anyway. For glioblastoma and several other forms of aggressive and lethal cancer, there are no cures or treatments that prolong survival, and most patients don't live long enough to lose weight, adopt an optimal diet, and use other strategies. There are exceptions to the rule, but if we're trying to look at probabilities and facts and evidence, it's a little scary to jump off the cliff and just use diet. For these types of patients, Seyfried's ideas may save their life. In many ways, Seyfried's research is in alignment with the plant-based community. He reports that cancer cells use plasma cholesterol as an alternative fuel. Good reason to eat a low cholesterol diet and keep your plasma cholesterol levels low. He says that calorie restriction and fasting improves and strengthens normal cells and weakens cancer cells. Adopting a plant-based diet is a much lower calorie diet for many, many people. And we've recommended water-only fasting for several years. The source of the angst is the ketogenic diet, which Seyfried has shown can prolong life for some patients with aggressive cancer like glioblastoma. When he was here, the last time that Dr. Seyfried was here a few years ago, he delivered a lecture during which he shared some case reports, one of which was a woman who lived for 7.5 years after her diagnosis of glioblastoma, and almost unheard of survival time for patients with this particular type of cancer. Seyfried is criticized by many in the plant-based community for basing his recommendations on case reports, even though many plant-based advocates have posted stories online and published case reports in journals showing that cancer patients who've used a plant-based diet as therapy have succeeded. He's criticized for not using control groups in his research. And I think something that you need to realize about control groups is that it's very difficult, if not impossible, to conduct research using treatments like diet for cancer, because it is considered unethical to withhold traditional treatments even when they have been shown to be ineffective. And that's a ridiculous thing, but we're not going to be able to do anything about it anytime soon. Many people have conveniently forgotten that Dr. Esselstyn's treatment of patients for coronary artery disease with diet has never included control groups, and that does not make his research and his findings any less compelling. Seyfried's criticized for making presentations to groups that are clearly not us or in our camp, like the American College for Advancement in Medicine, or ACAM. It didn't seem to bother anybody when Dr. Colin Campbell, author of the China study, was a presenter at an ACAM conference in 2010. So I think what we don't want to do is be overly critical of Seyfried and hold him to a standard that we don't apply to, quote unquote, our own. In fact, I think we should consider Dr. Seyfried our own. This brings me to the problem that I think is really troubling a lot of people that have reacted similarly to when we had Dr. Seyfried come the last time, which is that Seyfried's work interferes with the idea that one diet, a low-fat plant-based diet, is a cure for everything. It's not, and those who take this stance, a one-size-fits-all approach to treating people, are both practicing reductionism and abandoning the use of clinical judgment, which is desperately needed in the practice of medicine today. People are not all the same, and their age and their limitations and their medical history and current state of health all have to be considered when making decisions on what to do for any health-related condition, and that includes decisions about diet. Dietary advice has to be tailored to the particular condition of the patient, and it often has to be combined with other treatments that include dietary supplements or cognitive therapy, exercise, physical therapy, and some conventional treatment. It's important to avoid dogmatic adherence to ideas and to think outside the box as we seek solutions for what I think anybody would agree is a tremendous healthcare crisis in the United States and in most other places in the world where westernized diets are prevalent. It is in this spirit that we have embraced Dr. Seyfried's work. We have invited him once again to present at our conference, and we hope to collaborate with him in the future. So I hope that this explains the whole situation a little bit better. I can understand where the confusion comes from. I don't understand the really negative, almost apoplectic reactions from some people about this issue. I got some pretty curious emails. But these are not incompatible ideas. If the goal is to do the best for people, to have the very best health outcomes, these are not incompatible ideas at all. All right, that's all for today. As usual, hit the subscribe button if you're not already a subscriber. Pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news.